So
Yeah, I
I don't know.
agree. And I think AI has a huge role to play. Our hospital at work just rolled out an AI scribe. So, a
Oh,
lot of people's experience when they go to a doctor now is the doctor is over here. Right. Not necessarily their fault. They have to get the charting done. They have 10 minutes with the patient. Eight of
right.
those minutes are spent writing everything down and making sure they've heard everything correctly. You maybe get 90 seconds of FaceTime where your doctor's actually listening to you. It's
Yeah,
just not a great experience. So, if you can take some of that computer burden out, it's better for staff because what burns doctors out is not being with patients. What burns them out is having so much administrative burden and constantly having to chart everything.
I
So
see.
these new systems have the potential to take some of that busy work away and allow more face-to-face time, and everyone's going to be happier there. That's one. A second thing is, I've used Grok multiple times with the vision mode now, where just for fun I'll be with a student and we'll point the vision at it and say, what is this? And it'll say, that's a laryngoscope. And I go, what do you do with that? That is what's used to place a tube in someone's airway. What size is it? It's a Mac 3, and so it's able to know all these things. And so
Wow.
pretty soon I'm sure you'll be able to go out in the field and it's not as good as, a trained doctor, but maybe it's 90% as good because it's going to be able to give you all this information and say, hey, based on this data, we need to triage this up higher, or hey, it's not as urgent, we can put them in we don't need a helicopter, we can just use a Tesla, whatever. So it'll
Right.
be you know I think we're going to start seeing fewer medical errors. I think we're going to see faster, more efficient care, and I think we're going to be seeing happier patients and doctors in the next couple of years as these systems start rolling in. We have Palantir systems at our hospital as
Oh
well. That
yeah.
was kind of surprising to see. So there's so many of these tools that aren't quite being used to their potential yet, but in a year or two they're going to be, and I'm so excited to see the levels of care improve dramatically from it.